So, starting off with the introduction, here comes the definition what it is. Basically, it is defined as action which is aimed at eradicating, eliminating, or minimizing the occurrence of disease, okay, or its like further complications. Or it can also be defined as patients or public when protected against the actual or potential health threats and their harmful consequences. So when we are talking about the levels of prevention, we are like talking about four aspects. The first one is primordial prevention, second is primary prevention, third is secondary prevention, and the last one is tertiary prevention. Okay, so coming to primordial prevention, it is basically the prevention of the occurrence of risk factors in the environment. Okay, from where it does not exist yet, so we are like preventing its occurrence. Okay, say for an example, many adult health problems like obesity, hypertension have their origin in early childhood. Okay, so this can be intercepted by modifying the lifestyle pattern and eating habits and physical exercises. Okay, so the main intervention in this is through individual or mass education. Now coming to next, that is primary prevention. This is the action which is taken prior to the onset of the disease. Okay, and then basically this is known as intervention in the pre-pathogenesis phase. So coming to the modes of intervention, it has two modes of intervention, namely health promotion and specific protection. Okay, so coming to first mode of intervention, that is health promotion. As the definition says, it is the process of enabling people to increase control over and to improve their health. These are the aspects through which we can promote health. The first one is health education, second is environmental modification, third is nutritional interventions, and the last one is lifestyle and behavior changes. The next or second mode of intervention is specific protection. The definition says protection given specifically against certain diseases. Examples of this is immunization, chemoprophylaxis, specific nutrient supplementation, safety drugs and food, control of environmental hazards. Okay, so WHO has given two approaches. The first one is the population strategy, and the next one is high risk strategy. So, talking here, with the help of an example, we'll understand this. Say, for an example, there's a hospital, okay, and it has a ward which is directed towards the treatment of COVID positive patients. Okay, so the healthcare workers who will be posted in that particular ward will be having more chances or will be at higher risk of acquiring the COVID virus as compared to the healthcare workers who are posted in some other departments or in some other wards. Okay. So, now coming to what the definition says, the population strategy, which is directed at the whole population irrespective of the individual's risk level, whereas high risk strategy, which aims to bring preventive care to individuals at high risk. The next is secondary prevention. It is basically the action that halts the progress of disease at incipient stage. Okay, so again there are two modes of intervention in this. The first one is early diagnosis and the next one is prompt treatment. So what the definition says, detection of disturbances of homeostatic and compensatory mechanism while biochemical and morphological and functional changes are still reversible. So in this diagram I have shown an example. So the dental caries at an incipient stage can be treated with the help of restorative procedures. Okay, so the third prevention here is tertiary prevention. These are the measures taken to reduce or limit the impairments and disabilities, which further minimizes the suffering caused by existing departure from good health and to promote the patient's adjustment to irremediable conditions. Okay, now coming to the modes of intervention of tertiary prevention, basically again two modes of intervention are there. The first one is disability limitation and the next one is rehabilitation. This is basically the intervention in late pathogenesis phase of disease. Okay, Coming to first, that is disability limitation. See what happens basically when disease occurs, it further leads to impairment followed by disability and handicap. Okay. So, what is the main objective of disability limitation? It is basically to halt the progress from impairment to disability and to handicap. Okay. Okay, so coming to what the definition says, impairment, it is basically any loss or abnormality, physiological, psychological, or anatomical structure or function. And disability is defined as any restriction or lack of ability of an individual to perform an activity considered normal for a human being. Handicap is defined as disadvantage for a given individual which results in impairment or disability, limits or prevents the fulfillment of a role that is normal for that individual. Okay, so here we are just what we have talked about, we'll be taking an example of that. Okay, so the disease here is accident, impairment is loss of food, disability is inability to work, and handicap here is unemployment. Okay, so through the dental context, the disease here is dental caries, impairment is loss of tooth, disability is can't talk or can't chew, handicap is can't socialize. Coming to the second mode of intervention, that is rehabilitation. What the definition says, it is basically all the combined and coordinated medical, vocational, social, along with educational measures for training and retraining of the individual to highest possible level of functional ability. Okay. So now what does the medical rehabilitation mean? It is basically restoration of the function. Psychological rehabilitation means restoration of personal dignity and confidence. Vocational rehabilitation means restoration of the capacity to earn a livelihood. Social rehabilitation means restoration of family or social relationships. So example of medical rehabilitation is provision of denture. Psychological rehabilitation is educating and motivating him to use denture effectively. Vocational rehabilitation means getting a job again, and social rehabilitation means ready to fulfill the role required of him by his family and society. Okay, so basically to sum up, here the first column shows the pathogenic phase, the second column here shows the levels of prevention, and the last column here shows modes of intervention. Okay, so here I put some examples of what all dental procedures that we follow in our daily routine practices come under with intervention. Okay, so this is just for like how much you have got through this lecture. The scenario one is there's an health educator who visits a village and educates the people about the benefits of quitting tobacco. Okay, so what level of prevention and which mode of intervention is given? Like the person or the health educator is just educating. Okay, so primary prevention, and the mode of intervention given will be health promotion. Okay, so this is scenario 2. Here a doctor does an oral examination in a village and finds out that few of the villagers have signs and symptoms of oral cancer. Okay, he advises them to go for the laboratory test and biopsies to rule out oral cancer. What level of prevention and which mode of intervention will be given? See, the doctor is doing oral examination. Okay, and the previous slides I have mentioned biopsy comes under secondary prevention. Okay, and the mode of intervention given will be early diagnosis and prompt treatment. So here comes the scenario 3. A person aged 40 years who is suffering from oral cancer has undergone the excision of his tongue and having speech difficulty. What level of prevention and which mode of intervention is given? Obviously, what we are doing here, we are just limiting the disability and rehabilitation. Okay, so tertiary prevention, and the mode of intervention given will be disability limitation and rehabilitation. Thank you.